Groceries, rent, and utility bills. Most Americans would say that health care and prescription drug prices are big things that they're struggling to afford nowadays.
Now, a new government report is pointing a finger at a group of people marking up prices. Our McKenna Earnhardt has a breakdown for us tonight.
Matt and Terry, the new report from the Federal Trade Commission says between 2017 and 2022, some of the biggest pharmacy benefit managers in the U.S. made billions by charging insurers more while they paid less for medication, and found those PBMs also lead patients towards their own pharmacies, therefore putting many smaller pharmacies, like some right here on the South Plains, out of business.
A lot of times when someone comes to fill their prescription at a local pharmacy, the insurance will say, no, you need to go to our mail order or our specialty pharmacy.
PBMs, the so-called middlemen in the pharmaceutical industry, only exist in the U.S. negotiating drug prices. The FTC says the three largest in the U.S. are pushing more expensive medications to their own pharmacies, making a bigger profit.
It's for cost savings. We knew that was a lie, and this report proves that that's a lie. It shows that over the past, from 5 years, from 2017 to 2022, they charged $7.3 billion over what they were supposed to be charging, like in excess, during those 5 years, so over $1 billion a year. And they're able to do that because they're able to hide these funds in companies they own. So they're just shuffling money from one hand to another.
Chris Hobart, owner of Highland Pharmacy, says this ends up hurting the patient because Americans are paying more for health insurance and not getting more for their buck.
That's why the premiums keep going up and so much money keeps getting doled out. It's not to us local guys, it's these conglomerates that are vertically integrated.
Which means local pharmacies like Hobart's are losing customers.
We'll save you $10 a month if you go to our mail order pharmacy. It's an easy decision, and they're like, hey, I like you, Chris, you're a good pharmacist, I still want to use you for other things, but my insurance says I can get a better price at their mail order. Well, we found out the reason now is because they're paying their mail order up to 4,000 times what they paid me.
The companies involved argue the FTC report only covers a small portion of drugs.
My license and my pharmacy can dispense those same drugs to you. Your insurance just says, we want to send it here, and now we know why. We have the proof that they are just doing it to raise costs for consumers and raise profits for themselves.
Hobart believes there is one solution to this nationwide issue.
If the government can intervene and just pay all pharmacies the same, there's no reason to have these preferred networks, specialty pharmacies. There's nothing special about them. That's what we found in this report.
This caused higher out-of-pocket costs for patients, up to $279 million more in 2021 alone, with prices rising by 14% to 21% each year since 2017.